Hello, I'm Dr. Mike. Today, we are going to talk about oral squamous cell carcinoma in cats. This is a cancer that is very serious and early detection is critical. To learn more about this type of cancer, we're going to meet with Dr. Mona Rosenberg, who is board certified in veterinary oncology.
A very common form of oral cancer in cats is called squamous cell carcinoma. Squamous cells are the cells that line our skin and our oral cavity. And unfortunately, in cats, dogs too, but in cats much more commonly, one of those normal skin cells or oral lining cells actually has the ability to become cancerous. We really aren't sure why cats develop this particular form of cancer so commonly, but some of the thoughts include the fact that when you look at the behavior of cats, with how fastidious they are, with licking themselves and cleaning themselves all the time, that their oral cavity becomes exposed to foreign objects on an ongoing basis. We know that cancer can be caused by chronic inflammatory processes. So if the mouth of a cat is always being exposed to these external foreign objects, that can set up a genetic mutation within the normal oral cell, and that cell can become cancerous. Typically, these cancers can occur anywhere within the mouth. We can see them on the upper jaw, on the lower jaw, or even associated with the tongue, in particular underneath the tongue. The most common presenting signs of a cat with oral squamous cell carcinoma is drooling, weight loss, loss of appetite, and sometimes even a little bit of blood tinged in the water bowl or in the saliva. And the reason that this occurs is because the cats start to develop difficulty in eating. Their tongues don't work as well as they should, so instead of being able to swallow their saliva, it tends to drip out. The other sign that we can sometimes see is bad breath or halitosis. And that's because the tumor itself can become infected with all of the bacteria that occur within the mouth. So should you notice any of these signs, such as bad breath or drooling or decreased appetite, please take your cat right away to your family veterinarian to be checked out. This cancer, like many other cancers that we're aware of, with early detection, we have a much better chance of providing good quality of life to your pet. If your family veterinarian finds a mass in the mouth of your cat, the first thing he or she will likely do is get some blood work and a urinalysis to make sure that your pet is healthy. Additionally, chest x-rays and perhaps even an aspiration of the draining lymph node is warranted to make sure the cancer has not spread. Then your veterinarian will put your cat under anesthesia to get a surgical biopsy and possibly even some dental x-rays in order to determine how invasive the tumor may be. Only with a biopsy can we determine whether or not your pet has cancer and the type of cancer. Once the diagnosis is confirmed, likely a CAT scan of the mass and the mouth will be performed in order to identify whether a wide surgical excision is possible for your cat. If it is, then a surgeon will likely go in and remove as much of that tumor and normal tissue surrounding it, because if we can achieve complete surgical margins, then likely the cancer is not going to come back. If we find that your cat is not a good surgical candidate, then we found that radiation therapy is very effective at controlling the disease, either shrinking it so that we have improved quality of life, or in some cases actually making the tumor go away completely. Your oncologist may also decide to use chemotherapy as a radiation sensitizer. Sometimes chemotherapy in low doses will actually increase the sensitivity of cancer cells to the effects of radiation, making the radiation much more successful. Chemotherapy in cats, as well as radiation, has very few side effects. And in fact, 95% of the cats that we treat with chemotherapy actually have no side effects whatsoever. The major reason for that is that cats don't know they have cancer, and so they don't psychologically have the same baggage that a person would have if they were undergoing the same sort of treatment. Our goal is always about quality of life.
Dr. Rosenberg gave us an excellent overview of oral squamous cell carcinoma in cats. If you think you notice a tumor on your cat's mouth or under the tongue, you should bring it to the attention of your veterinarian immediately. If found early, surgery, radiation, and/or chemotherapy may actually provide a cure for the cancer. If a cure is not possible, Additional therapy may include antibiotics and pain medicine to help provide the best quality of life possible for your pet. I'm Dr. Mike. I hope that this information is helpful, and thanks for watching.